Welcome to In Alignment, Life, Leadership, and Dentistry. I'm Dr. Sara Mahmood, dentist, aligner educator, speaker, and mom of three, navigating the wild ride of clinical practice and family life. This podcast is your go-to space for all things clear aligners with real talk on dentistry, leadership, and the juggling act we call life. Whether you're looking to level up your aligner skills, build more confidence in your workflow, or just feel a little more seen in this season, you're in the right place. Let's get in alignment and grow together. Let me tell you something surprising. When I first started lecturing for SureSmile, I included my treatment planning packet as just visuals in parts of my presentation. And I thought it would be helpful just for people to see how I do things in my offices. But to my surprise, it became the most talked about thing I shared. And I get it. Creating a treatment planning packet from scratch is daunting. Design, formatting, legal language, scripting. It can take weeks, months, years. But here's the good news. You don't have to start from scratch. Rather than reinventing the wheel, you can grab my exact template or even my full packet on my website, sarathedentist.com. It's taken me over a decade to refine this, and all you really need to do is pop in your logo, tweak the colors, and you're off to the races. Seriously, changing a logo takes a couple of minutes. Building an entire patient communication system from scratch, that took me a decade. So work smarter, not harder. Let's talk about what makes a SureSmile treatment planning packet powerful, because this isn't just paperwork. It's your patient communication strategy. It's clarity, trust, and education all in one. Here's how mine is structured and why. I've got the treatment plan proposal right up top. I present two options, comprehensive and express. I clearly state that you have to be considered a good candidate for express. You can't just choose. Comprehensive includes attachments, IPR, unlimited revisions for 2 years, whereas express is ideal for simpler cases where no attachments, IPR, or in-office check-ins are included, only virtual. On the back end, as I've mentioned, we're ordering complete cases for both. But the express is going to lead to less chair time. So that's how we monopolize and put a lower fee for that. Now, what's not included and what is included is clearly listed. Both the plans include the V-Pro and whitening, just not retainers. We keep our fees accessible up front and charge for retainers at the end. This avoids confusion and prevents the, I thought that was included conversation later, because it's clearly written there. I also have a financial agreement where we lay it all out, pay in full discounts or check or cash. I also have an in-house financing option with a down payment. I do third-party financing as well. And then I make clear terms for missed or late payments, which we also note that insurance must remain active and any unpaid portion becomes the patient responsibility. So all of this is very clearly written. And we really want to make financial transparency the number one way to reduce that drama and increase patient acceptance. Um, as far as compliance and success factors, we spell out what it takes: 22 hours a day of wear, 2-week intervals, proper use of the V-Pro and Chewies, good oral hygiene. We also highlight age, anatomy, and biology as variables that can impact movement. It's all about setting realistic expectations from the jump. I also put all this in my revision aligners agreement. This is a part of my template as well. And this is big because we outlined how many are included in each plan and what happens once attachments are removed and the case is closed. If they want to restart after that, it's a brand new case. I have an orthodontic insurance utilization form. We always want to leverage insurance when applicable, but we clarify that insurance is an agreement between the patient and their plan. And so then patients are responsible for anything not covered. Treatment has to be paid in full before completion. So if there's outstanding payments from insurance, we're not going to wrap up treatment until the payment is completed. And then we also make sure there's no assumptions and no surprises. I also have an FAQ form. I converted this into a video form as well. But this saves your team time and keeps patients off Google. We answer things like, what if I lose a tray? Or what if an attachment falls off? Can I vape during treatment? That's all the rage these days. So we want to make sure we're addressing that. And is it normal to feel sore? Answers should reflect your own protocols, not Reddit threads or online forums. And then I also have a general consent form. This is straight from SureSmile. I just reformatted it to match my branding. And it goes over everything from risk, gum irritation, discomfort, estimated treatment time, and it includes a HIPAA release and a section on retainer wear. You'll also want to get verbal and written consent for things like IPR and attachments. I also include a media consent form. I love showcasing these results in my lectures and on my social media, so we include a form for social media and internal documentation. Even if you're not super active online yet, having that release is really helpful. Now, a packet alone isn't enough. It has to be presented clearly, intentionally, and patiently. So here's what I recommend. Don't rush. Give patients time to digest and ask questions. And avoid jargon. Say things like tooth-colored buttons instead of attachments. Walk through the finances. This is the make or break moment for many. Ask open-ended questions like, what questions do you have, instead of, do you have any questions? That's yes or no. We want to get open-ended questions. And then you want to get signatures after the discussion, not before. And remember, this packet is just as much for your team as it is for your patients. You want to train your staff to use it, refer to it, and reinforce its messages. So, whether you're just starting to build your packet or looking to level up, I hope this gives you a solid foundation. And if you want to skip the guesswork, I got you. Just head over to sarathedentist.com where you can purchase my exact template or the full version I use across all of my practices. No more spending time designing something from scratch. You can use my decade of experience, make a few tweaks, and get back to what you do best, which is changing lives with dentistry. Because great communication leads to great case acceptance and even better patient experience.